Croeso I bawb, hoffwn I ddiolch I addysg a gwella iechyd Cymru am y gwahoddiad I ymuno â chi heddiw yn eich amseroedd a eithriadol, ymarfer eithriadol. 13 diwrnod y gynhadledd AHP. Mae'n bleser siarad gyda chi fel gymuned aml broffesiynol o bob cwr o'r Gwasanaeth Iechyd a Gofal Cymdeithasol. Bob un wedi ymrwymo I sicrhau bod yn darparu gofal o'r ansawdd uchaf i'n poblogaeth. Gofal sydd â'i wreiddio mewn tystiolaeth ac wedi liwio gan ymchwil yn gysylltiedig â gwasanaethau. Gofal sy'n canolbwyntio ar ganlyniadau, yn seiliedig ar ansawdd, diogelwch ac yn sicrhau gwerth uchaf posibl. Welcome to everyone. I'd like to thank Health, Education and Improvement Wales for the invitation to join you today at the Extraordinary Times Extraordinary Practice 13 days of AHP conference. It's a pleasure to speak to you as a multi-professional community from across the NHS and social care, all committed to ensuring that we deliver the highest quality of care to our population. Care that's embedded in evidence and informed by service-related research. Care that's focused on outcomes based on quality, safety, and achieving the highest possible value. I'd like to thank each and every one of you for all you've done over the whole pandemic. You've continued to work tirelessly to ensure our services have been able to respond to the many challenges that they faced. You've also rapidly introduced new ways of working and grasped the opportunity to improve the way in which you work with greater use of technology and stronger collaboration. It's important we use what we've learned over the past 2 years to support the system to recover from what has been and continues to be an incredibly challenging time. The current imbalance between demand and capacity requires radical and transformational change. Urgent action is needed to avoid continuing growths in waiting lists and to minimize clinical risk. Too few people are accessing the community rehabilitation, reablement and recovery services that they need to recover fully and to avoid unnecessary long-term care. Making this change, the vision of a healthier Wales, relies on you shifting your skills and resources to primary and community provision, making better use of the diverse assets we have locally to support people and to respond to individual needs. We must concentrate our efforts on the whole system, putting citizens at the centre and surrounding them with resilient, local, primary and community care. Our recovery plan, Health and Social Care in Wales, COVID-19, looking forward, builds on the key lessons we've learned. It demonstrates our commitment to social partnership, to values and expectation of future integration and integrated approaches. And it sets out our expectations of delivery. Our 3 national programmes, planned care, urgent and emergency care, and the strategic programme for primary care have been refreshed. I expect each of you, your colleagues and leaders, to be thoroughly embedded in the work to achieve the intentions of these programmes in order to deliver the quality of healthcare we want for our family, our friends, and our communities. It's vital that you participate in the delivery of that change, working at the top of your licence and skill set to address service challenges. Your own professional strategic framework underpins these national programmes. And I'm really pleased that the implementation of Looking Forward Together, the Allied Health Professionals Framework in Wales, is firmly in place. I'm impressed with the examples I keep hearing of, the innovative changes that you're making to develop services. Your skills are essential in helping keep people who are waiting for treatment as well as possible and to help people recover. I've heard where you're reducing waiting times and variations in services across Wales, making far more of your services directly accessible and moving far more of your work into the community. We know that many people have far more complex needs than they did before the pandemic, and your skills are vital in providing urgent and emergency responses, supporting people in a crisis, and delivering rehabilitation, which enables people to live independently in their own homes. This conference is a wonderful opportunity to share your learning and agree how to deliver the value-based care I know you can. I'm looking forward to hearing more about your transformation over the next year, and I do hope you enjoy the rest of the event. Diolch yn fawr iawn i chi gyd. Thank you so much. Dwi'n gobeithio wnewch chi fwynhau gweddill y digwyddiad. I do hope you enjoy the rest of the event.